This video will be very helpful to orthodontists and orthodontic residents who are getting into Invisalign but have a good knowledge of how teeth move with conventional appliances. So I have a case that I want to show you. It's an end-on class 2 bilaterally. We have I set it in the mode where I can show a quick modification. The lower arch is crowded like so. So you see this retroclination of the teeth and crowding, and there's also a curve of SPE, which you can see being leveled on the screen here. The upper arch has moderate crowding, and for now, I have set those teeth so that they can't be moved. That's why you see them darker. Let's look at the Overjet. All right, now, here's what I want you to see. When you have a curve of SPE and crowding, curve of SPE is a form of sort of hidden crowding beyond the misalignment of the teeth because your teeth are distributed along a curve instead of a straight line. And so if you see here, I'm not showing you the curve of SPE yet, but if you remember, it was leveling. But look at the lower arch, and here you see the teeth becoming straight. And I want you to key on a few things. Look at the mesial aspect of the lower right tooth. If you notice, the tooth on the mesial seems like it's pivoting. You don't see any forward movement of the mesial aspect of the lower right tooth in this correction. You can see some of it on the distal aspect. Yet, when you look at the clincheck in this view, here's the mesial aspect of the lower right tooth, and you do see forward movement of it. So this is sort of a trick with optics. And I'll tell you the clinical significance of this, but I want to show you one other thing as well. Here is the starting position of the canine. And I had said the lower incisors are crowded, and I say retroclined or upright. I don't have a ceph to show you, but I think you can notice that they are more upright. And look at, there's a bit of a mesial root inclination on that lower left canine. And in the final position, that root angulation is improved more to sort of the normal. However, this would represent what a cinched arch wire might do, where you're preventing mesial movement of the crown. But this is a very difficult movement for aligners and maybe even for braces, because what you're seeing is the lower arch is intruding, but not really coming forward that much. And so again, the overall reduction of the overjet, remember, I did not move the uppers forward because I wanted to make this point. I showed you in the occlusal view that there seemed like there was forward movement, but it doesn't really seem like there's a reduction in the overjet that you might think would happen with a, say, reverse curved wire where you get some flaring of the lower incisors. So I'm going to show you the modification I make on this treatment for our purposes. This is an adult that we're not going to use any kind of mandibular advancement. We're going to accept this occlusion, this skeletal pattern. But in the lower arch, this is not how teeth move. And I want to set up this plan so I can align those lower teeth, maybe get a little overjet reduction with compensation of the lower incisors. And so what I'm going to do is I am going to change the root angulation of that tooth. By the way, you can see, look how that brings the lower incisors forward a bit. Now, again, you might think, well, wait a minute, didn't I just accentuate the problem? Well, here's what I'm going to do. This is a mandibular deficiency, and that is how teeth are going to move. Now, you might be thinking, what about that space? And I'm going to say that is going to be a space that the patient's going to accept. Let's see on this side. And I also am going to remove some of that intrusion because I'm not advancing the mandible. I don't need to level that curve of SPE much as I would want to if I was going to do a surgical treatment and I want to have a locked-in occlusion in a more forward position. So I'm asking the aligners to do less in this case. This is an adult, and I've removed some of this intrusion. I'm still going to get those teeth straight, but I really want you to see what's going to happen with the Overjet when I do this. Canines I'm going to raise up too. So I'm asking less of this clincheck. Now, let's look at the Overjet. And let's see what happens with this. Look how they are right up against that. Too much. Now I am going to bring the uppers forward. And the reason this is important is if you have a case with lower crowding and maybe you have a more of a class 3 tendency and you ask for that kind of intrusion that you saw you initially before I made this change, and you did not see them come forward, that may be a way you would think virtually you'd avoid anterior interferences. But in reality, the teeth are not going to intrude that much. And I think that they are going to, this is a more realistic way to straighten these teeth. And by the way, even if I were to reduce that spacing, I think you'd see the same issue. Okay. Now I can go ahead and line up the upper anterior teeth, and I'm going to have a more accurate read on what the overjet reduction would be. But I left them there so you could see the difference. If you remember in the beginning, you did not see the lower incisors come forward, but they will come forward. And if the aligners don't have that programmed, it's going to lead to poor tracking and possibly other side effects that you don't want to see.